All right, welcome back, and it's time for us to talk health. And today on the health segment, we're talking joint pain. This is a conversation that interests a lot of people, especially when you are climbing up the age ladder. Yes. And Dr. Kelvin, our wellness consultant, has joined us in the studio. Dr. Kelvin Owusu, good morning and welcome.
Thank you very much.
Yeah.
But I have a question. Why did you stress on the age is catching up that point? Like
that point. But is it not true?
There was too much emphasis.
No, but is it not true?
No, but I think
no, but is it not? As a wellness consultant,
there's more in this one.
As a wellness consultant, is it not true that as you get older, your joints need more grease?
But you see, they say experience is the best teacher.
So has it started?
Has what started?
The pains.
Which pains? Which pains?
See, Kwaku is a very strong man.
No, which pains are you talking about? I don't know.
The one you were stress emphasizing on.
Oh no, I mean I've been working out, lately, and I've noticed some pains that I didn't used to notice.
Okay. Right.
Yeah, so that's the challenge. But I mean, yeah, well, I mean, okay. So you see, we are looking at a joint pain photo.
Yes.
You can see it's a joint pain photo.
It is.
Yeah, so some of those pains,
happening to you. Eh? Well, you're not alone. I mean, it is indeed one of the most common reasons why people come to the hospital. So yes, you are right. It's a very, it can be troubling. And the thing is that everybody has gone through some form of joint issues at some point. I mean, everybody injures their joint every now and then. Whether it's your wrist, your elbow, your knees, especially. Your ankles. I mean, especially when you are quite physically active, your ankles are always
one of those
exactly,
that will have issues.
That will have issues.
That reminds me. I have a situation these days.
These days?
See, these days.
Okay.
I'm trying to think back now. I think maybe in the last 2 years that it's been like that. If I sit like this in a vehicle, at the office, whatever, for let's say an hour plus, and I stand up, I notice my Achilles heel.
Yeah.
Okay, there's pain in there, and it takes maybe about 3 to 5 minutes walking for the pain to ease, and then I'm back to normal.
Yeah. I mean, it happens, especially if you have not been active for a while, and then you start getting active. You can't get a situation with that. And I think what you are describing could actually be plantar fasciitis, which is probably an injury in the fascia. There's a fascia. Fascia is some form of connective tissue, in several different places. And in the foot we have the plantar fascia. Okay. So when it gets injured, you can't have the situation you are describing. It's mostly worse when you have had long periods of inactivity. So people, when you go to sleep, for instance, and your foot has been in a certain position for a long time, so you wake up in the morning and realize that just when you try to step on the leg, it gets painful. But after a few minutes of walking up and down, it gets better. So it's relieved by movement, which is actually quite. I mean, these are some of the symptoms of joint pain. Some of them are worsened by movement. Some of them are actually relieved by movement. So there is a whole range of symptoms that you can get when you have a joint issue, which obviously suggests that there's no one disease condition that causes joint pain. Okay. So depending on the etiology, or depending on what kind of disease condition or whatever process is going on in the joint, you can have different symptoms, which helps us to determine which particular issue we are dealing with at this particular time. Okay. It's because not all joint pain is joint pain. Okay.
So really?
Yes.
Okay.
Every pain needs to be investigated to find out what is causing it. Okay. Because in most cases the treatment for one would be different from the treatment for the other. Okay. Some pain is just joint pain, nothing extraordinary. So let's say you are playing football, somebody kicked your knee, you have knee pain. Yeah. It's localized to the knee. There's nothing else going on. So but we can't just sit down and assume that there's nothing going on, because it could be a red herring. Yeah. In medicine, when we say red herring, it means that there's something else going on, but then
it's presenting as
yes. So or rather, because of the pain because of the kick you received, it's brought that issue to the fore. Okay. So we still need to investigate and find out if there's anything else going on.
Okay. Like a fracture or something like that.
Well, like a fracture, or is it something more systemic? Systemic means that is it something affecting the whole body? The whole body. Typically, autoimmune diseases can actually cause joint problems as well.
Which kind of autoimmune disease?
So I'm sure you've heard about rheumatoid arthritis.
Yes.
That's actually one of the more common autoimmune diseases that affects the joint. Okay. It affects other things as well, but you find it in the joints. Typically, the joints.
Extremities.
Extremity, yes.
Yeah. So sorry, when it comes to that, does it have to, is it only linked to old people? Because that is what people make it sound like, oh, okay, my grandma, my mom, it's always the older people who have arthritis. Yeah. So is it only linked to older people?
So let's back it up a bit. When you say arthritis simply means inflammation of the joints.
Okay.
So arthritis by itself does not necessarily impute a particular diagnosis, but you can have rheumatoid arthritis, which then gives an indication of what is causing the arthritis. You can have osteoarthritis. You can have a reactive arthritis. You can have drug-induced arthritis. So arthritis just refers to the inflammation.
Osteoarthritis, I think I've heard that.
Exactly.
Yeah.
Inflammation of the joint. Now, generally speaking, joint problems increase as you grow older. You see, older.
Why are you pointing my direction?
But the three of us, we know that
nobody
when we say older.
Okay. It's just that OJ is not here. But
so generally, your joint problems will increase as you grow older, especially in the extremities. So your knee, for instance, because you've carried the joints have carried you all through your life. You've abused it, you've misused it, you've done all sorts of things to the joint. So as you grow older, the probability that it's going to start giving you problems is higher. Look at the joints of the back, for instance, and there are joints everywhere. There are even joints in your skull. So not all the joints necessarily move like your elbow joint or your knee joint. There are also joints that don't really move as much. And then there are joints that by themselves may not move significantly, but when you take them all together, they provide significant movement, like the joints of your spine. You see, individually
they don't move much.
But then their combined effort is what will help you to bend, to stand, to sway to the left and right, among other things. Now, that is also some of the most abused joints we have, especially as corporate workers. Now I see how everybody's like readjusting their sitting
I was
position.
just like
yes, because I mean we have terrible sitting posture, so it's not surprising that we are diagnosing a lot more spondylosis. I'm sure you've had spondylosis all over the place. So cervical spondylosis, for instance. So now your sitting posture coupled with mobile phone habits is actually causing problems for a lot of us.
What's the difference between spondylosis and scoliosis? Because I hear these two words quite often.
Well, scoliosis is a curvature of the spine. Then there's also kyphosis. So scoliosis would be a curvature. There's a technical definition. But basically a curvature on the
spine.
In the spine along the axis is a bit complicated. Kyphosis is when you are bent forward.
Okay.
Scoliosis is when you are tilted to the side. Yes, so either the left side or the right side. Some people have a combination of the two.
What?
So you could be born with it, or it could develop as a result of certain disease conditions or certain postural issues that you have adopted along the line. So, for instance, if you are, let's use somebody who is disabled. I mean, who has an issue with one leg, so has to support themselves with a cane, a crutch. That person will inadvertently develop a form of scoliosis because there's a lot of
bent
on one side.
On one side, if you carry a lot of weight with one part of your body all the time, you're going to develop some form of compensation because the spine will sort of curve towards the area where the weight is to compensate. So you end up developing those things. Tilted, and so these are things that happen along the line. Now then there is the spondylosis, which is a degenerative disease. Because of the abuse I mentioned, because you are not sitting in the right posture, you are not sleeping in the right posture. Some people have terrible sleeping posturing, or they use terrible sleeping material, and so all these things put a lot of pressure on the bones of the spine, and then cause those degenerative changes, and then you now have the pain, which is then diagnosed as spondylosis. Then we have so before I move on, so osteoarthritis of the spine is actually what we call spondylosis.
Okay.
But this osteoarthritis can also occur in any joint pretty much. In fact, almost every joint problem would eventually end up in osteoarthritis because osteoarthritis is the degeneration of the joint itself. Okay. So if you have rheumatoid arthritis and it progresses and causes damage to the bone, you could then be diagnosed as having osteoarthritis, you see. So everything, it comes to that. Footballers or sportsmen, who have suffered recurrent injury to the joints can also end up with joint problems later in life. You see, because I mean, the injury healing can result in problems later on. Somebody who has had a fracture that entered the joint could also develop osteoarthritis along the line. especially if the healing is not properly done. That's why typically fractures that enter the joint, nobody will watch it heal by itself. They would typically take you to theater and try to reduce it as much. When I say reduce it, make it as close to the natural as possible. Because if there's a small gap or there's a small overlap or anything like that, it will cause you problems moving forward, especially if it's in a weight-bearing joint like the knee or the ankle. So typically any injuries that affect the joint would be treated a bit more aggressively. You know, infections can also cross into the joints. Typically, the joint is well protected. Things don't just enter in there. But you know, in medicine, we never say never. So sometimes infection can actually break the boundaries and enter the joint and cause significant damage.
What's a typical joint made of? Because I'm asking this question because of what you just said, that not anything can just cross into the joint. Yeah. So what's a typical joint made of? What are we seeing there?
So there are different kinds of joints, but the typical joints, let's say a knee joint or an ankle joint, would have the bone, the cartilage that covers the bone. So the cartilage is like the smooth surface to sort of reduce the friction as much as possible. Yeah. Then you'd have the synovial fluid, fluid in the joint, you know, to also serve as cushion or shock absorber and also lubrication. You know, then all this is protected in a sheath, and that's a sheath that is more or less impenetrable, you know, to anything coming from outside. There are even no blood vessels in the joint space itself. Okay. You know, the blood vessels end at a point and everything else is carried through diffusion. Okay. So all those mechanisms are put in place to protect the joints, because once infection gets in there, it can cause damage. You know, because just as there are no blood vessels there, it means that there are no white cells there either. So when infection gets there, it can take a while before the body is able to mount the defense to get there. And so when you come to hospital, sometimes it might require us to actually open the joint and wash out everything there. Oh wow. You know, so yes, I mean, joint issues can create a lot of problems for the individual, and we don't want it at all. Yeah. Children are at risk, you know, because they depend on somebody else to take them to hospital. So if the parents are not in a position to bring them, it can be quite damaging. And the problem is that if a child has a joint problem and it's not treated properly, you know, they have their whole life ahead of them with problems. You know, imagine a knee joint that because of osteoarthritis has to be fused. Because sometimes one of the ways of dealing with this thing, especially if money is an issue, is to just fuse the joint. You know, because if the pain is extreme and we cannot do a knee replacement, for instance, you know, then we have to. But
if you fuse the joint in the knee, it means the knee becomes like a crutch.
Yes.
And it can't bend anymore.
Yes.
No.
Wow.
Yes. So but it's extreme, but it does happen.
How is that beneficial for the patient?
Well, it takes away the pain.
Okay.
It takes away the pain, but you can't.
Yeah. So now you have to just lift your leg and move.
Exactly, because the thing is,
as one unit.
If you
sit down like this, that means
you have to sit down your legs.
I mean, if every movement is painful, so excruciatingly painful that you can't do anything else, sometimes the alternative is to, you know, intervene. But like I said, there are better options, you know. But for lack of money, you know, we might have to resort to some of these operations. We don't take kindly to that, you know.
Yes. So, okay. You said that children can be affected.
Yes.
And so it's not really an age thing, or is it still an age thing?
So it's an age thing in the sense that the probability increases as you grow older. I mean, children can be affected in certain cases. For instance, trauma. If a child has a traumatic knee injury, for instance, that child is at risk of a joint problem. You know, and that joint problem would the probability of that joint problem occurring increases with age. You know, so the injury might have occurred in childhood, but the child may not have any problems with the joints during that childhood. In fact, can go through even young adults without any issues. But then suddenly 40 years, 50 years, the knee is really giving the child problems, you see. And then the other issue too is, let me just touch on this important thing, obesity. Obesity is also a risk factor. So age is a risk factor. Your weight is also a risk factor, especially for your weight-bearing joints. Okay. You see, when I say weight-bearing, I'm talking about the joints that carry your body.
Carry the load.
So your knee, especially. You see, if your knee is carrying more weight than it was meant for, you know, then your risk of developing joint problems increases. You know, and you actually see that when people begin to gain weight, if you're observant, you can actually tell their knee begins to bend. Either it starts bending outwards or starts bending inwards. So you notice that especially in females, you know, there's another reason why, which is menopause. But typically, after menopause, a lot of women begin to notice changes in their knee.
Yeah, okay.
You know, so the knee actually begins to bow out.
Wow.
Or you know, bow in.
Wow.
And it's because of the weight they are carrying. Because at menopause, the estrogen levels begin to drop, and they begin to have problems with calcium metabolism. And you know, calcium is what's going to keep the bone strong. So that's why we typically recommend that women should be on calcium supplements after menopause. You know, so now the bone is technically weaker.
Okay.
Carrying the same weight it was carrying, or even more weight than it was carrying before. You know.
So has the bone become softer or more brittle?
A little bit of both.
Okay.
Because estrogen protects the bone. It sort of gives protection to the bone through the calcium metabolism. Now there's no estrogen. Okay. You know, so the bone becomes weaker and can fracture. In fact, hip fractures are common after menopause for women. You know, so it is a risk that needs to be managed. But it's compounded by your weight. So if you're able to keep your weight in check, or at least within a reasonable, you know, range of your BMI, it helps to protect you from some of these problems. And so if this same person, let's this same woman, happened to be a sportswoman in the past and had some injury to the knee, then the risk of the knee problem is compounded more, because now the age is there, the weight is there, and then the previous issue with the knee also comes up. You know, so the sins of the past will chase you.
Catch up with you. So is it possible, from everything that you said, that you can have a knee injury when you're like a teenager, and it will completely go away, that it will not revisit you ever again? Is it possible?
It's possible.
Can you heal?
It's possible. However, like I said, with age, there's always a scar. Let's say if you have a cut on your skin, for instance, the scar will always be there. You know, it might get smaller as you grow older, but the scar is always there. So now, picture that scar in the knee joint, right? Okay. There's not supposed to be anything there apart from cartilage covering it. So now, if in the future that scar in the knee joint has reduced, all right, but it's still there. So now we've already spoken about obesity. Now with your obesity and the extra weight carrying, there's some increasing friction, because now the joint space is now touching each other. They technically are not supposed to sit on top of each other. So now that friction is there, so the cartilage begins to wear. And then that small scar that was not significant back in the day suddenly meets the other bone. Now it becomes an issue. You see, so that's how it typically works.
Okay, I have a proposal. I think that this topic is way too broad to handle it in the required detail on this segment, as we've done it. I'm thinking that we should look at different aspects of joints and the pains that come with them. Figure out the causes, figure out the treatments and all of that in subsequent shows.
All right.
You like it?
I like it.
Okay. All right. So we'll do that. Yeah. So thank you very much to Dr. Kelvin Owusu. We've been discussing joint pain. And if you missed it and you're just joining us, kindly go over to our YouTube channel, CitiTube, and that's where you can find this particular segment and all other segments nicely packaged. Now, Dr. Kelvin, how can people get in touch with you?
Kelvin Owusu, MD, on all social media channels.
Okay, all right, fantastic. So go over to social media, Twitter, Facebook, wherever, Kelvin Owusu, MD.